Patricia.
Thanks, Alicia. Time now for my political panel. National Senator Bridget McKenzie and Labor MP Anne Ali are both my guests. Welcome.
Great to be with you, PK.
Bridget McKenzie, you're a Victorian, and lockdown will be relaxed for regional Victoria from Thursday night. You know, there are a few provisos, but some restrictions will remain. Do you support the strategy that the Victorian government is embarking on?
Well, PK, it's been devastating news about the lockdown in Victoria. I think the Daniel Andrews State Labor government's first response is always to lock down our whole state, and for the last 18 months, National Party, federal and state MPs have been very, very clear in my home state that regional Victoria, many places have not even had one case, are being treated the same as Melburnians. So obviously having this differential is welcome news, finally. We would have loved them to have adopted this sort of approach earlier, as we've seen the Palaszczuk Labor government do in Queensland, and obviously the Liberal government in New South Wales have a more targeted discrete response to COVID outbreaks. I mean, I guess that's the frustration out in the region. So whilst we welcome this lifting of restrictions in our own communities, if all goes well over the next 24 hours, it has been incredibly debilitating, with this last 7 days costing regional communities over $150 million in economic losses, with no COVID case to be seen.
Follow-up question to you before I go to Anne Ali, just because you're a Victorian too. The Victorian government wants financial support for workers that have been stood down, casuals, all these workers who are clearly really doing it tough at the moment. I speak to Victorians who tell me that they feel abandoned by the federal government, like it's just sort of a state that can be ignored. Do you think that the Treasurer needs to step in and provide financial support for the struggling Victorians who can't work because the state's locked down?
Yeah, there's over 500,000 casual workers in my and your home state who are out of work because the state Labor government has shut down businesses, PK. Now,
sure,
if you actually want to look at...
Why have they shut down business? Because there was a hotel quarantine failure in South Australia and the virus got into the community,
PK,
right?
Can I finish? I just wanted to say that it's really a tale of two ways to deal with outbreaks. I mean, this, as we've been saying for 18 months, we've got to learn to live with this virus, and there's going to be outbreaks over time. We do not have, and nor should we have, an elimination strategy in this country. Now, you see New South Wales, 125,000 people through their quarantine. Victoria, 31,000. New South Wales locked down a little over 40 days. Victoria, this is our fourth lockdown, and we endured over 112 days, which is the longest lockdown in the world. So there are different ways to deal with the problem, and I would argue that it has been the Victorian Labor government's decision to shut our economy down, and they refuse to take responsibility for that. When the Labor government in Queensland and in WA were faced with a similar situation, they did not lock the whole state down, and nor did they come to the federal government with their hand out for their own decisions. So, you know, I think the federal government has stood by Victorians. We've delivered more money into the pockets of businesses and community members than any other state. And at some point, our state government has to take responsibility. They could not contact trace a zebra crossing Collins Street, and we continually have to pay the price. But obviously the Treasurer has made the commitment to talk to his Victorian counterpart this afternoon, and so we'll see what will come of those discussions.
OK, now I have to challenge your zebra line. How can I not? Because Paul Kelly, the Chief Medical Officer, tells us that the Victorian contact tracing system is quite good, you know, and it's working. So how can you talk about zebras, Patricia, when he says something different?
Well, they can't seem to find the right Woolworths, and it's not. This is not a red versus blue argument. Please, I'm not seeking to politicise this, because the contact tracing in several Labor states absolutely in spades beats our own. And this is not about the contact tracers themselves. This is about the system that we've implemented. We've had 18 months to get this right, and I cannot believe that our state is here again. We do need a nationally consistent approach to quarantine, and we need a nationally consistent approach to what the definition of a hotspot is and how we're going to treat it, and to stop this carte blanche, draconian locking people up and locking businesses down with severe economic and social costs. I was talking to a young mum mum in regional Victoria who all of a sudden has all her kids at home, can't get to work because she's got to homeschool them again. I mean, it's just incredible that this government doesn't think through the implications of their draconian decisions.
And Ali, I've given a bit of a run to Bridget McKenzie being a senator from Victoria, but you're right to reply on that. And particularly that the onus should be on the Victorian government to deal with the consequences of whatever decision they've made about lockdown and not step in on federal funding. What do you think?
I was just about to get the popcorn then, Patricia. Look, yeah,
we'll provide
the
it next
government,
time.
the federal government, the federal LNP government would have you believe that the states are responsible for everything that goes wrong and they're responsible when everything goes right. They want to take the credit when things go right and blame the states when things go wrong. The fact is that Victoria is in lockdown following the health advice because of an outbreak of COVID-19. The reason that we have that outbreak of COVID-19, two reasons: because we don't have, as Bridget said, a nationally consistent quarantine regime that should have been about a Commonwealth quarantine facilities. It is the Commonwealth's responsibility. It is this government's responsibility. And two, we don't have an effective and timely vaccine rollout. Just imagine for a minute what it would have been like if we actually did have the 5 million or so Australians fully vaccinated, as the Prime Minister promised when he first announced the vaccine rollout. Imagine if we did have a government, a Scott Morrison government, that took responsibility for national quarantine. I think we would have a very different picture right now, and we would not be talking about lockdowns in different states and looking for fingers to blame, or looking to point the finger and blame people.
OK. So, Bridget McKenzie, you did mention quarantine. And we know there's been 21 breaches. So while we keep hearing that it's 99% effective, when it goes wrong, it goes so wrong. It is so devastating for the people affected by the mistakes or the breaches, or in this case, the fact that this person, tested positive after they'd left hotel quarantine, which is pretty unpredictable, right? Shouldn't we get more of these centres, more of these best case scenario centres like Howard Springs? Isn't it time for the federal government to do that work?
Yeah, Patricia, I mean, I think we've got to go back to when National Cabinet made the decision. The premiers put up their hands and said, we'll look after that one. You go and do that, we'll go and do this. Now, we're 18 months down the track, and obviously as a federal government we've made a decision to expand the facility at Howard Springs, and that work's underway. It's now taking in excess of 2,000 quarantine participants at the moment, and looking to expand it. They've also made the commitment to look at the proposals from various state governments, including the one from our Victorian state Labor government. So that's going through the internal processes of government, and I think my understanding is there's been a bit of assessment work on that particular Victorian proposal, bearing in mind we've only had it for 4 weeks. But the situation remains, Patricia, you're dead right. There are going to be outbreaks. I mean, we saw in Melbourne over the tennis with the Australian Open, there were outbreaks. So we need to have a proportionate response to this, right? And I just, again, compare the tale of two states, how New South Wales has dealt with their outbreaks. They've been able to quickly and strategically shut down those localised areas and make sure that it doesn't spread any further. That's what we need to be able to do. And what you saw last week, Patricia, was Melburnians en masse jumping in their cars, putting their caravans on the back, the tent in the back of the boot, and heading out of town, out into the regions to escape what they know will be a harder and tougher response from Daniel Andrews.
And Ali, just going back to what Bridget McKenzie just mentioned, she says, well, they're considering this Victorian proposal. Does that settle the issue for you, the fact that the government's looking favourably on this idea?
Well, Bridget keeps saying it's been 18 months. Yes, it's been 18 months, but we also now deal with different variants of COVID-19. We know that now there are much more virulent variants of the virus that are airborne. Hotel quarantine may have been suitable at the beginning when National Cabinet first met, but it is woefully inadequate to deal with new variants of the virus that are airborne. The government should have jumped on this when the report first came out that recommended Commonwealth quarantine facilities. And I think I've said on this show before, PK, that Australia is a world leader in rapid building technologies. It's not rocket science. There is no reason why we couldn't have built Commonwealth facilities that are safe, and we could have done it quickly.
Let me just put this to you. No, 1 minute. Sorry, Anna Lee. I just want to just ask her something. She hasn't had as much time. That's been because, Bridget, I think you're from Victoria and I wanted to hear your views as a regional Victorian. But Anna Lee, I do want to ask you this. The ABC is reporting this afternoon that Scott Morrison doesn't want to come in and step in on financial support for Victoria because he doesn't want to establish incentives for the states and territories to go into lockdowns. What do you make of that? That you know, the reluctance is that it will be too easy to go into lockdowns.
I think that's just an excuse that he concocted. It's absolutely ridiculous, isn't it? I mean, you know, there are sectors that didn't get any assistance even during the government stimulus package. You know, the tourism sector, arts, casuals, all of those sectors. You know, that didn't incentivise them to go further into lockdown, did it? It's just a ridiculous excuse. I think people can see right through it. Okay. To be honest, I just find it unfathomable that he would even come up with that.
Look, Bridget McKenzie, I'll put that to you, that the government's reluctant because you don't want to set a precedent or an incentive. Is that how you see it?
Well, I think none of us want to see businesses shut down and families lose their home because they can't make mortgage repayments because premiers have locked down entire states in response to a handful of cases in one particular area.
And is it your view that it'll make it easier to lock down if the federal government...
Patricia.
Is it your view...
That's a reasonable response, I think, absolutely. I think the state governments need to be responsible for the decisions they make. We have been unequivocal with changing our response to the virus as required, both economically and socially over the last 18 months. We're going to continue to do that until we're in a post-pandemic world, which will be many years away, I might say. And in terms of the vaccine rollout, which is the other sort of component, I mean, there's been a level of complacency in the Australian public about getting the vaccine, about waiting and seeing what happens to others, etc. And I've had it in conversations out in regional Victoria over the last few weeks. So I think the onus is on all of us as individuals to do the right thing in social distancing, to actually make sure we get vaccinated and make sure our families are vaccinated as quickly as possible so that we can build a sort of COVID safe, if you like, Australia, and then begin to open up not just our state borders but importantly our international borders.
All right, we're out of time. Thanks to both of you. Anna Lee, I'll give you two
just
paragraphs.
Just one thing.
I'm a fair person. Go.
Thank you. Look, you know, Australians have been doing the right thing. They've been incredibly, incredibly great through all of this. They have socially distanced. They have done the right thing. To suggest that, you know, there's complacency and Australians need to do more of the right thing. The complacency and the hesitancy is because this government is giving mixed messages about the vaccine. You know, that's the issue right there, PK. Okay. And thank you for letting me have a response.
And I know
there.
Bridget McKenzie probably wants to reply and say, yes, go get vaccinated. Okay. Let's just agree that we're all going to get vaccinated. I can't wait to get my second jab. National Senator Bridget McKenzie and Labor MP Anna Lee there. And yes, please get vaccinated.